Human movement is a product of continual reform. The fetus, for example, exhibits what appear to be crude, unsophisticated movements. During subsequent years, movement progresses to a state of considerable intricacy. It is these early forms of movement, however, that experts believe are often linked to the attainment of more complex voluntary movements of later life. The movement behavior of a human being from 4 months in utero to approximately 6 months following birth is dominated by movements known as the primitive and the postural reflexes. A reflex is an involuntary routine response to a particular stimulus. In other words, when a stimulus is applied, such as touching an infant's palm, the infant responds by closing the stimulated hand. This response is basically invariant and occurs subcortically. That is, the response occurs without a conscious decision being made by the infant. The brain is not directly involved in the movement production. The electrical impulse elicited by the stimulus simply travels to the spinal column. From there, the appropriate movement message is issued to the muscles involved in the response. There are many reflexes exhibited during later fetal life and infancy. Normally, these reflexes are divided into 2 categories, the primitive reflexes and the postural reflexes. Many of the primitive reflexes function in the attainment of nourishment for the infant. They are crucial for survival. The palmar grasp, described earlier, is a primitive reflex, as are the morrow, startle, search, and sucking reflexes. Other primitive reflexes are the Babinski, plantar grasp, palmar mental, palmar mandibular, and the asymmetric and symmetric tonic neck reflexes. The postural reflexes are those which are believed by some experts to be particularly significant in the development of the more advanced voluntary movements of later life. Examples of postural reflexes are the crawling, stepping, and swimming reflexes. The neck and body riding, the labyrinthine, pull-up, and propping are also examples of postural reflexes. Kathy Taylor, health education and former childbirth educator and pediatrics nurse, discusses the importance of our knowledge of the infant reflexes.
Today in the United States, we have a trend towards consumer awareness. Many parents are taking childbirth preparation classes in order to better cope and understand their labor and delivery experience, and then they're following this up with programs on parenting. Involved in the parenting classes is to help them understand the physiological development of their children as well as the social interaction. In learning the reflexes of their infants and their children, they can better understand meeting their needs as well as to establish a greater bond and a greater communication system, because they can recognize the body language of their child and not just wait for the communication through crying and speech later on. The primitive reflexes is search, sucking, morrow. They pick up pretty much by observation, and that these are necessary for survival. The postural reflexes, they need to have a little bit more instruction on, so that they can help them through play and general interaction to help stimulate these reflexes for later development in the motor area.
The age of onset and disappearance of each of these reflexes may vary slightly for each individual child. In most cases, however, these reflexes can be accurately predicted. In fact, a significant deviation from the usual timeline can be indicative of neurological dysfunction. For this reason, some early reflexes are used as diagnostic tools by pediatricians. Excessive strength, weakness, lack of symmetry, or total absence of a reflex can all be a sign of motor impairment. Even though a child is at the age in which a particular reflex should normally be visible, the reflex may not appear. The child's behavioral state may prevent the reflex from occurring. To elicit most reflexes, the child must be in a state of quiet rest. If the child is restless or crying, attempts to evoke the reflex may fail and should not, in this case, be assumed to be indicative of neurological dysfunction. Let's now examine more specifically some of the major primitive reflexes. The palmar grasp is one of the most well-known of all reflexes exhibited during infancy. This reflex is commonly displayed from birth through the first 4 months of life. The palmar grasp is believed by many experts to also exist for some weeks prenatally. This reflex is elicited by stimulating the infant's palm. The accompanying response is the hand closing tightly around the stimulating object. The thumb, however, is normally not involved in the palmar grasp response. Another primitive reflex, the moro, is also believed to appear prenatally. This reflex, which is normally inhibited by the end of the 3rd month of life, is a commonly used diagnostic tool for infant neurological examination. Dr. Gilbert Martin, pediatrician and director of the Neonatal Intensive Care Unit at Queen of the Valley Hospital in West Covina, California, demonstrates the moro reflex on a 3-week-old infant that was born 3 to 4 weeks prematurely.
Let us look, if we can, for a moment, some of the more specific reflexes to see which ones can be determined in an infant of this age. One of the most primitive ones is the reflex which we call the moro reflex. This reflex can be elicited several different ways. One way is to keep the baby in an upright position and suddenly lower the baby approximately 10 centimeters. The reflex really then consists of an extension of both of the arms followed by a flexion. This is a little different than the startle reflex, which typically is more of a flexion rather than the extension. The other way to initiate the moro reflex is one which I'm going to try to do right now. If you take that out, please. And that is by taking the baby's arms, extending them, and bringing the baby just like this. And you notice that there's a first flaring of the both hands with a full extension of the arms, and then slowly you begin to get a flexion of both arms. This is a reflex which is seen early on in a baby of 34 weeks gestation. In order to have one which is a symmetrical reflex as we have right now, shows the baby from the standpoint of this test of neurological development is seemingly intact.
The startle reflex is similar in many ways to the moro, but it may not appear until approximately the 7th month of life. The startle reflex would normally be suppressed 5 to 6 months later. Like the moro reflex, the startle can be elicited by a rapid change of position of the head. An abrupt tap on the abdomen when the infant is supine should also elicit the expected response. In this case, upon stimulation, the fingers, arms, and legs move directly into an acutely flexed position. This differs from the moro reflex, which is characterized by an extension of those body parts preceding the flexion. The search reflex is one of the more well-known reflexes. This reflex, which may persist throughout the first year of life, is elicited by stimulation of the cheek near the corner of the mouth. The expected response is a turning of the head in the direction of the stimulation, thus enabling the child to seek food. Another nourishment-related reflex is the sucking reflex. Like the search reflex, the sucking reflex is present at birth. Unlike the search reflex, however, the sucking reflex may disappear around the end of the 3rd month of life. This reflex is elicited by stimulating the area of the lips. The result is, of course, a sucking action which enables the child to ingest his or her food. At the end of approximately 3 months, sucking will continue, but voluntarily, not as a reflex. Dr. Martin explains and demonstrates the sucking reflex.
The sucking reflex itself is made up really of 2 separate reflexes. And these reflexes are important to understand. There's an expressive component where the tongue applies positive pressure, and you can see he's about to do that. As the tongue applies positive pressure to the finger. And secondly, there's a sucking component where there's a negative intraoral pressure and the jaw goes down. So both of these things are important. And you can see that this baby has a very good sucking reflex. And this shows that there is some maturity getting to the 34th to 36 weeks. Babies do suck in utero. There have been infants born with so-called sucking blisters, and this is probably the most primitive of all of the reflexes.
Also present at birth is the Babinski reflex. This reflex is elicited by a stroke of the sole of the foot. Upon such a stimulation, the toes of the stroked foot extend and spread apart.
The Babinski reflex can be positive up to 2 years of age in children and probably means nothing neurologically. However, the reflex is elicited by taking an object and stroking the lateral edge of the foot to the medial edge, and there's usually a flaring of the toes and then a cringing of the toes. And here, this baby did the flaring and has a minimal cringing response on the right side. You have to wait till the baby's tone is quiet. The left side, there's a flaring and is not followed by a cringing whatsoever. But the flaring is the positive aspect of the Babinski reflex, and you would call this, in this particular infant, a positive Babinski reflex.
The plantar grasp reflex can also normally be elicited at birth. This reflex may persist until the end of the first year of life and is elicited in a manner much like the Babinski. By pressing the sole of the foot, the toes of that foot will flex as if attempting to grasp, as in the palmar grasp reflex of the hand. The resultant response, therefore, is quite different from the Babinski, despite the similarity in the stimuli. Two particularly interesting reflexes are characterized by a facial response following a stimulation of the hand. The palmar mental reflex is evident from birth to 3 months of age, and is elicited by scratching the base of the palm of the hand. Such a stimulation causes a contraction of the jaw muscle, which results in the mouth being closed by a raising of the lower jaw. The palmar mandibular reflex is also elicited by a stimulation of the hand. This reflex, also known as the Babkin, usually persists from birth through the 3rd month and occurs when pressure simultaneously is applied to the palm of each hand. A number of responses may occur. For example, the mouth opens, the eyes close, and the neck flexes, tilting the head forward. Any one or all of these responses may occur upon applying the appropriate pressure to the palms. Finally, a discussion of the primitive reflexes would not be complete without examining the 2 tonic neck reflexes. The asymmetric tonic or the symmetrical tonic neck reflexes are commonly seen in premature babies. They may not be observable, however, in older infants. The asymmetrical tonic neck reflex can be elicited when the child is placed supine with the head turned to one side or the other. The arm and leg on the face side extend as the limbs on the opposite side flex. This tendency gradually fades away, as do most infant reflexes, but can be elicited up to 50% of the time in most 3 to 4 month old children. The symmetrical tonic neck reflex is observable when the infant assumes a supported sitting position. The stimulus can be a flexion or an extension of the neck. If the neck is flexed, tilting the head forward, the arms flex and the legs extend. If the neck is extended, tilting the head back, the arms extend and the legs flex. Now that we've examined a number of the primitive reflexes of infancy, let's discuss some important postural reflexes. These reflexes, remember, are thought to be associated with the development of the voluntary movements of later life. The crawling reflex is an excellent example. In most cases, this reflex is present at birth and persists throughout the first 3 or 4 months of life. To elicit the crawling reflex, the infant is placed in a face-down position. Alternate stroking of the soles of the feet is the necessary stimulus which results in a crawling-like action of the arms and legs. In most cases, a time interval of 3 to 4 months then occurs before voluntary creeping is observable. The stepping or placing reflex also appears early in life, usually during the first 6 weeks following birth. Normally, this reflex disappears by the 5th month of age. To elicit this reflex, the infant is held in an upright walking position. The stimulation occurs as the feet are allowed to touch the supporting surface. The pressure on the bottom of the feet is the stimulus for a left-right walking action involving alternate knee raising. However, the corresponding arm swing, as seen in mature voluntary walking, is not evidenced. Perhaps one of the most unusual and interesting of reflexes is the swimming reflex. This reflex is elicited by placing an infant horizontally in or over water, or even over a solid object such as a table. The corresponding response consists of well-coordinated swimming action of the arms and legs. This swimming reflex, which has been observed as early as the second neonatal week, is usually inhibited by the 5th month of age. Also included in the list of postural reflexes are the head and body righting reflexes. These reflexes, which are believed to lead to voluntary rolling movements later in life, are believed to occur from approximately 2 through 6 months of age in most infants. The head righting reflex is elicited by turning the infant's body when in a supine position. The head responds by righting itself with the body. That is, the head returns to a front-facing position relative to the shoulders. Another form of head righting is demonstrated by Dr. Martin.
The baby is taken up by the hands to see what muscular tone the baby has in the neck, and note that there is complete head leg, but at the end there is very good head righting and the head falls forward.
The body righting is somewhat similar to the head righting reflex. However, the head in this case is turned to one side or the other. The accompanying response is the body righting itself with the head. In other words, the body turns in the direction of the head movement, so the head is, again, in a front-facing position relative to the shoulders. The labyrinthine reflex is one which generally appears at approximately 2 to 3 months of age and endures throughout the remainder of the first year of life. This reflex, which is believed by some experts to be critical to the attainment of upright posture, is characterized by a tilting of the head in direction opposite to a tilting of the body. For example, if the child is held and tilted to the front, the head extends back to maintain its original upright position. This reflex also occurs to both sides. That is, as the body is tilted to the left or right, the head responds by tilting in the opposite way. Another reflex which appears to be related to the maintenance of the upright position is the pull-up reflex. This reflex appears at approximately 3 to 4 months of age and, like the labyrinthine reflex, may persist until the completion of the first year of life. To elicit this reflex, the infant is held by one or both hands in an upright sitting or standing position. He or she is then tipped in any direction. This stimulus elicits a flexion or extension of the infant's supporting arm or arms in an attempt to regain the original upright position. The propping reflexes also appear to be related to the attainment of upright posture. Propping reflexes occur when the infant is tilted off balance in any direction. Being off balance in an upright position generates a protective movement in the direction of the potential fall. For example, a forward propping movement of the arms is observable as early as 4 months of age. When tilted toward the front, a propping or parachuting out of the arms occurs as if the infant were consciously aware of the potential fall. However, infant reflexes, as mentioned, are involuntary. This involuntary propping reflex can be observed for both sides around 6 months of age. The backward propping reflex may not appear until 10 to 12 months. All of the propping reflexes frequently persist past the first year of age. Now that we've specifically examined a number of primitive and postural reflexes, let's summarize these involuntary responses that dominate neonatal movement. The primitive reflexes that we observed included the palmar grasp reflex, Moro reflex, startle reflex, search and sucking reflexes, and Babinski reflex. Other primitive reflexes which we examined were the plantar grasp reflex, palmar mental reflex, palmar mandibular reflex, and asymmetrical and symmetrical tonic neck reflexes. The postural reflexes included in our examination of infant movement included the crawling reflex, stepping reflex, and swimming reflex. Also included were the neck and body righting reflexes, labyrinthine, pull-up, and propping reflexes. All of these reflexes, primitive and postural, appear to be vital in human development. They are not only important in the detection of neurological problems, but may actually be crucial to the survival of the infant. Furthermore, some experts in human development believe that these reflexes are the necessary stepping stones to the eventual development of more sophisticated, voluntary movements of later life. They are an interesting, unusual, and vital element in the attainment of mature human development.